No, I don't forget to start it. But I've coughed.
As soon as you get on here.
I haven't had a cough. I'm gonna knock on wood.
But you were like, let's go, let's press play, and I was like, oh.
I know. And here's why. I'm making you sympathize with me. Also, hello, welcome to the Medicare Cafe.
Howdy.
We are in the pre-chat where we get on and talk a little early. If you do want to interact with us, you sure as heck can.
What was that noise?
That?
Oh. I felt like something.
Je ne sais pas.
Fix the chat, too.
Ben was in a meeting this morning.
Oh, Ben.
And he had the audacity. And the thing is like, I yelled at him because he was working in here. And they're doing, like, a men's group. Like a you know, how we help each other. Because we had a women's group. They're doing a men's group.
Yeah.
So I said, Ben, get out of there. I got it. I don't got it. And I'm not going to tell Ben that we missed him. Anyways. But no, with you coughing, I've done this twice now. I did yesterday. We were on this phone with an agency I'm really excited about. We're pitching them. We're saying like why you should join Senior Marketing Specialists. Here's what we can do for you. Not only do you get to work with our awesome team, but we can blah 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 blah. Right?
Yeah.
I'm in the middle of talking about Medicare Center, the technology, like how like our technology saves time and energy and money. And I start, like, tears down my face. Like,
Coughing.
I'm crying. And it's, like, a tight, like, pinch.
Mm-hmm.
And it's, like, I'm in the middle of my portion of the pitch. Crying. I'm trying to, like, eat a cough drop. But then the cough drop is making me salivate. And, like, so it was, like,
this
a
sounds terrible.
person's worst
Man.
nightmare. And it was this agency we were really excited for. And I kept having to be like, I'm so sorry. I'm sorry I exist. And then I was just on the phone with our good buddies over at Retire Flow.
Okay.
He was telling me about their end of year stuff, and in the middle of me talking about what we did, it happens again. And I'm just like, him and I at this point are best friends, and I was just like, I'm sorry, I'm dying. Like this happened yesterday, and it was just the whole thing. Anyways, that's not why the people came.
Not good. I just had a little tickle.
How is your AEP? How are you?
Good.
Yeah.
I'm really happy with how AEP went.
Good.
Like I feel like it went smooth.
Oh, we had very different AEPs.
I feel like
you and I had very different AEPs. Okay, so yours was smooth. Why do you contribute?
I didn't have any apps that were like pended for anything.
Okay.
And I think I was just like,
well, the last week of AEP, your whole family came down with like massive illness, right?
Yeah. So I mean, that was pretty rough.
I don't mean that. I feel bad for you. That was chaotic.
But, like, as far as, like, the actual, like, apps, the appointments, like, there was nothing, like, big that, like, stressed me out other than just, like, the hecticness.
Just, like, the back-to-back appointments and the late nights.
Yeah. I felt like it was a smooth AEP.
So, listen.
And I feel like it went faster than... You always say that on the other end.
We're going to talk about this in one of the slides. Today, we're talking about how do you check to see if your AEP was actually successful. Did you grow? You know, we're going to talk about metrics like... Okay. How was your AEP?
Okay.
One of the slides on there is you need to take time. It's the last slide. I'm jumping ahead, but we'll get there. You guys, I'm not ruining anything. It's you need to actually write down right now, like how you felt about AEP. Because I feel like AEP is like childbirth.
Yeah.
Right? Like leading up to it, everything's terrible. You're in the thick of it. Everything's really, really terrible and everything sucks. And then like when you're done with it, you're like, that wasn't bad.
Yeah, you
like let's
about
do it again. And
and you
wrong.
do.
And you do. And then that time you're like, this is really bad again. This is terrible. And like it's just this vicious cycle. So like I think you're having post-baby brain.
I am.
AEP
because
style.
I think the last time I was in here,
it was you telling me like it's great.
I told you that I was like, I think the night before I told Glenn that I was like, it's not worth it. I can't do it.
The last time you were here, you were just like, I don't know.
It was.
I don't know.
But
it's not
that's
worth
the
it.
like the weight of
that's the labor.
Weight of the busyness that was weighing on me. Not the like when I look back, I don't know.
That's the labor.
For me, what stresses me out because I'm such a like organized person,
yes.
What makes my AEP hectic is like this app is pending, we're missing this, or this number was wrong, or you know, I haven't heard from like 70 people.
Yeah. As
far as that goes, I thought it was smooth.
Okay.
Do we really look this like white and washed out, or is it just my shirt?
Well, here's the other thing that happened. I also told them, because they're really busy, both Alex and Ben, I told them, like, guys, we don't have to worry about the color. We'll figure that out.
So I just look like
It's the
ghostly.
color is incorrectly because I thought we didn't need to worry about it. And looking at me, I disagree with myself. Lessons learned. Talking about lessons learned, that's what we're talking about today. What's going on and how to analyze your AEP. What lessons can you learn? You did it, right? And AEP's done. We're a couple weeks outside of AEP. So this is what we need to do. We need to talk about like how successful was your AEP? Do you even know if you're measuring the correct things? And what were the most common pitfalls we saw during this AEP? Something that I want like graved on my like headstone. I said it one time and I'm like, I'm going to live and die by this quote. So it's going to be like my quoting myself because I love it so much. But I truly believe that the only way that you can like measure success is how well expectations were met.
Yeah, I agree with that.
And so how well were expectations met? What did you expect going into it?
Yep.
Did you have the systems and processes? Were there any curveballs that came on that like I wasn't expecting this issue or I wasn't expecting this opportunity? You know, how successful was the AEP?
So Brian, one of my managers, he always says like at the end of the year, he's like, what do we need to stop doing, start doing, and keep doing? Like we make a list of those three things. And I feel like that's really helpful because it's like, what do I need to stop doing that I did this year? What was not helpful?
Yeah.
What should I start doing? And what do I need to keep doing?
But you need to make that list now because otherwise you'll come in here and be like, it was so smooth.
I know.
Everything went great.
I know. Yes.
So the first thing I wanted to do is talking about one of the measurements that I see get thrown around. Let me try again. One of the measurements that we see get thrown around AEP chat rooms, social media chat rooms, is talking about what people are measuring. A lot of people will boast about the amount of apps they submitted and talk about, I did this many apps, I had this many appointments, I took this many apps today. And
I couldn't tell you how many apps I did.
And I mean, that's what a lot of people...
I can tell you exactly how many new clients I got, though.
Exactly.
Yeah.
And so something is like, it does not matter how many apps you submitted. No. None of that matters. Number one, how many enrollments did you have, right? How many applications actually turned into enrollments and you didn't lose them? Anybody you wrote in November didn't get reassigned in December. But I think most importantly is, did your book of business grow?
Yeah.
If you spent your entire time rewriting and like trying to maintain, it's important. I don't want to discount that. You need to maintain your book of business. That's money that you have in your wallet. But when you write a plan on an existing client, you're just putting money from your left pocket into your right.
Yeah.
The numbers look phenomenal, and it's cool because oftentimes you're going to be on leaderboards and you get to see these crazy, numbers come in and your commission statements go huge because there's all these new apps. But it's not more money into your bank account. It's not new blood in your CRM. So that would be my number one thing, is double checking. Yeah. Did your book of business grow?
Like, I don't even have like an app goal, really. Like, mine's just like a new client goal.
Wow. How do you determine your new client goal? Is it just like a dartboard situation?
No.
Nothing's dartboard with you.
No. I look at how many I got the last year, and then I just think realistically, how much can I grow?
How much more can you grow? Did you hit your goal? Oh.
This short.
3 short of your goal? How big of an increase was your... You don't have to give me specific numbers, but how big of an increase was your...
I wanted 100, and I got 97.
You wanted 100 new clients during AEP?
No, for the year.
Okay.
Sorry.
Girl, there's still got 11 days, 12 days left.
I know, and at 10:30, I'm going to get 98.
That's awesome. That's awesome. So, again, checking that out. Yeah, it's already 10:10. We got to get out of here because you got to call at 10:30.
Oh, you're good.
The next one I want to say is, like, how are you measuring your success? Is actually measuring, like, do you know what marketing plans are actually working? Marketing, there's a difference between marketing and prospecting. Marketing is a marketing is a pull style marketing tactic. That means that people are aware of your brand, they're aware of you, you're the obvious choice. They're not responding to an ad or responding to a lead. It's your brand, right? That's what marketing is. It's really difficult to measure because it takes a lot of different variables for your brand to be a recognized thing, for people to have that familiarity.
Most people keep track of that, right? Like, I mean,
no one tracks that. Very few people that I work with actually know, like, what marketing techniques work and what don't.
So, like, on every sheet of my, like, if I get a new client and I have their name, and right under their name is how they found me.
Yeah. So but again, you made it a point to ask, how did you find
Always
me?
ask. I guess I don't understand how you don't ask. Like, how do you ever know what's working?
This is what we're telling the people.
I know, but how do you not know it's working?
Exactly. Well, that's just it. And what's hard is because you'll do this and you'll say, oh, I've asked these people. No one said my billboard. No one said my radio. No one said this. Well, they're not going to.
Interesting.
Because it's
Unless
all
you
about
ask.
Unless you ask, but oftentimes like people are gonna say like, oh no, like you're a referral. Well, yes, it's a referral, but they're constantly seeing your message is solidifying your brand, becoming more familiar. So it's not that the marketing doesn't work; it's just a lot harder to measure. But how do you know what's working, what's not, if you don't ask? Making sure you ask your clients, how did you find me?
I was surprised. I feel like a lot of people, like client referrals, they're quick to tell you like, oh, Nancy sent me.
Yeah.
You know,
you want to build that connection.
Right. But like I had tons of people this AEP that heard my seminars earlier this year.
Mm-hmm.
And, you know, seminars are something that I remember.
Yeah.
Multiple of almost all of them. I don't know if I got any clients, maybe a handful from the seminar.
Yeah.
But they all trickled in during AEP.
Yeah. That's a really good point, too, to know that, like, it is a trickling effect.
Yeah.
That, like, most of your marketing activity, not most, but a good amount of your marketing activity you actually won't see is not going to be instant. No. It's not designed. That's why it's so important to keep your funnel full and have multiple. We always say a 3-pronged marketing system. Mm-hmm. You always have 3 proactive activities going at all times. Mm-hmm. Seminars, if you're working leads, if you're doing social media advertisement, you just have to have 3 things going on at all times.
Like it.
The next thing, do you know your net promoter score? For those of you who are unfamiliar with a net promoter score is basically a score from negative 100 to positive 100.
Negative 100.
Yes, it goes all the way down to negative 100 to positive 100. And the way Brian, he says he's late. I have to have you read Brian's Christmas poem, which Brian, I wasn't included in the Christmas poem. Yeah, he writes a poem for all the SNS people. I didn't make the cut this year, Brian. I was not in the poem.
Oh, no.
It's fine. Anyways, but the net promoter score, not that I'm bitter, but the net promoter score, basically if somebody rates you a 8, 9, or 10, then it's just if they rate you a 9 or a 10, your net promoter score goes up. Yeah. If they rate you a 6, 7, or 8, your net promoter score stays the same. And if they rate you a 0 through 6 or 0 through 5, your net promoter score goes down.
Goes way
fast.
Way down so fast.
Yes. And so it's and it's for sure, again, like most, like Amazon's net promoter score is like 63. Chick-fil-A is like 64, 65. So like, and those are renowned as being incredibly, I think Senior Benefit Services is in the 80s. Mm-hmm. You guys have an incredible net promoter score.
We were 89.
89. Senior Marketing Specialist is 70. But what you can do is what happens during AEP is because you do get caught up in the hustle and the bustle, maybe you don't appropriately set the right expectations for your clients' appointments, so they don't quite, their expectations of service isn't met. But during AEP, we tend to see that net promoter scores go down. And that's saying that are you sacrificing service for efficiency, which is never something that you want to do. People, and sometimes it's just an expectation. If you don't tell a client that their appointment's going to be 30 minutes instead of an hour and a half, then of course they're going to be upset with the service that they got. So that's oftentimes what it is. But if you're not measuring your net promoter score, then you can't really track to see how well your AEP performed as far as service is concerned. You can count apps, you can count new clients, but you need to make sure you can keep that NPS up as well.
And as weird as this sounds, like I had 2 bad ratings. Mm-hmm. And those 2 bad ratings, I reached out to them and I was like, Colleen, please tell me, like, I am so sorry. What did I, like, tell me how I can fix this? Like, what happened? Because I thought everything was all hunky-dory and things were fine. And it was just a complete miscommunication. Mm-hmm. She had, I'm a little bitter about this. She was mad that I was on maternity leave and that she had to work with my assistant.
The audacity of you reproducing.
I know.
Who do you think you are?
I know. But, like, knowing that, like, I am always hypersensitive to when she reaches out, that, like, she's just one that, like, needs, I don't know. She's just one of my high maintenance clients. Mm-hmm. But, like, And then another one, I reached out and she had thought she had rated me a 10, but it was a 0. And she was like, no, how do I fix this?
Mm-hmm.
So like, watch, if you do the net promoter score, just like watch it, because a lot of times like people make mistakes too. So
yeah, that's what we do. We do the same thing. If you rate us a negative score, or if you rate us a detracting score, which is again like 1 through 6,
I reach out to
reach
all
out.
of them,
and it's not that it's a bad thing. It's like, what can we need to learn from
exactly.
that.
Yeah.
Oftentimes they hear SMS and they don't know that it's us. Because there's another SMS out there.
Yeah.
And they don't know that it's us. Or there will be a situation that, like, maybe we didn't call them back in a time that they expected. Like, during AEP, we say 48 hours.
Right.
Because we know it gets crazy. But if they're still expecting our 12 to 24-hour turnaround, then, of course, that's going to upset them. It's all about expectations.
Exactly.
The last thing I want to say for as far as how do you measure.
This is what I want to measure.
Yes, if you're measuring how well your AEP went, is what other types of SEPs did you use? If you only used AEP, there are still people turning 65, still people retiring, still people moving. If the only AEP or only SEP you used was AEP, then like your marketing isn't working.
Yeah.
Because you should be still getting a large amount of people in those other situations that fit to them.
For sure.
If you only
AEP was definitely the minority of my steps
and
used.
that's weird. I don't think it has to be the minority.
It was,
but,
I know.
But for you, again, but that explains like your marketing. You didn't slow down any of your other marketing during AEP.
No.
Like you kept on, again, you did seminars that weren't AEP-based seminars. You did seminars for people leading up, up to AEP, but not AEP themed. Again, it just goes to the importance of like, it has to be business as normal. You just have to do more targeted marketing in addition to your current marketing. So if you only did AEP business, that's a goal that you should have for next year is how can you systemize a lot of your other marketing so that those other situations don't slow down.
Stacy asked, how do you get a net promoter score?
Yeah, Stacy, that's a great question. We use a program. It used to be called Rocket Referrals. They've rechanged it now to like client referrals. But what it is basically, you can also do this. Google also has a service that you can purchase. And what it does is an automated service to where it'll email your clients. You can even upload a list of your clients or like send it to specific people. But it says, if you recently serviced them, it'll say, how likely are you to refer Kari to a friend? If you rate on a score from 0 to 10, how would you rate your services with Kari? We'll grade on a score from 0 to 10.
And then the best part is the testimonial.
Exactly.
Like they can write their own testimonial.
If you rate them and if the person ends up rating them, then they'll get a second question that's like, tell us why you gave them that rating. So if they rated you poorly, it gives them a chance to say what went wrong.
Yep.
If they rated you positively, it gives them a chance to get that testimonial.
Yep.
And
those testimonials are what I blast every Tuesday. I have Testimony Tuesday on Facebook and like get those out there. Yeah. They're wonderful.
What the numbers stand for is that people who rate you a 9 or a 10 are your referral. Yeah, they're your promoters. Those are the people who are most likely to talk positively about your services and share your information with your friends and neighbors. The 7s and the 8s are the people that like, they don't have any issues. Their expectations were met, but they're not likely to call up their neighbor's dog walker and tell them about your services. People who give you a 1 through a 6 are detractors. They're likely to actually spread negative information. The lower they rate you, the more likely they are to actually detract from your reputation and hurt your brand. So yeah, again, Google has those services. Look up Rocket Referrals. It is a bit on the pricey side, but we've been using that service now for 7-8 years.
That's what a lot of the big ones use.
Yeah, right? Wildly worth it for us, for sure.
And they send it. Is it like once a year?
Well, it depends. It depends on how you actually have it submitted to Rocket Referrals. Like for ours actually ties into our CRM. So if we're working with an agent a lot, for us, our CRM is agent-based, but for you to be client-based, if you're uploading or changing a client's profile often, it'll send them a referral because you're working with them more. Okay. Yeah.
I just thought it was like... Yeah. The S's go and
no, there's somebody much more smart, smarter than me, not more smarter, obviously. Somebody smarter than me understands how that works.
Got it.
But it does, because, like, the best time to ask for a referral is after you help them.
Okay.
So it'll figure out, like, have you recently worked with this client?
Uh-huh.
Send them the link.
Got it.
Yes. The last thing I mentioned, again, it's kind of just talking about what I started today's podcast about, which is just, like, you really need to take time to review.
Mm-hmm.
Or it might be a situation like it's labor and you forget how awful it truly was. So you won't remember AEP come January. Take the time to write down your thoughts and prepare to implement change. It's not enough to recognize what went wrong. You have to make sure you're putting in actions.
For sure.
And, like, if you had an AEP, I'm not talking to you, Kari. I'm talking to everybody else who had a very smooth AEP. This doesn't apply to you.
Who did have a smooth AEP?
Yes. Anybody who said my AEP was wonderful, I wasn't that stressed, I didn't have that many hiccups.
I wasn't stressed.
For everybody else, Kari, not for you. If your AEP went very smooth, it's very likely that you didn't have the growth that you could have. Because if you're growing, it's gonna hurt. You're gonna be stressed. You're gonna have issues come up. So if you were somebody other than Kari, that felt really confident, was really happy, and had a very smooth AEP, we need to make sure that you are.
I'm in the after labor.
I think you're in the after labor glow, and you're just like, pregnancy wasn't bad.
Let's go back to the recorded conversation from, like,
quite literally, and
3
you're
weeks
like,
ago.
I don't know that this is worth it. Let's, like, revisit that, Kari.
I know.
Yeah.
I know.
But again, if you do feel like it went well, reevaluate. I think maybe you sold yourself short on how much you could have grown.
Agreed.
I'm gonna drop a mic there.
Agreed.
I don't mean to come after you. I'm never confrontational. I'm gonna be a little confrontational. Care Bear don't care. Ryan, I tolerate you.
It was definitely stressful. But it's the time. It's just the biggest thing for me is time.
Yeah. Well, because you have a limited time. Not only do you not have 24 hours in a day, right?
Yeah.
But then you also
15 hours
have
a week in the
exactly
office.
only 15 hours to where you can dedicate to actually seeing clients. Terry, who's, like, my favorite. Terry asks, when you get a referral and know the person, should you send a gift or at least a thank you to the referee? If that's
Thank
a
you.
reward?
I send a thank you to every single one of my referrals.
Yeah.
And then, like, my, like, strategic partners, I get them a little gift usually at the end of the year.
Yeah, I like that. Here's
Usually
what I
it's
don't.
the beginning of the year, actually.
Well, your AEP
Because
was
the AEP. Stop it! Cut me off.
But
See ya.
Bye. So what I'd like to say about this is that the one thing you don't want to create is, if you do, like, gifts and things like that, you don't want to create the expectation,
Right, that they're going to get a gift every time.
And you don't want this to be like a monetary exchange, right? Because the best way to burn a bridge is to include money. So I really like after you get one referral, then, like, you get, you send them a thank you card.
Mm-hmm.
Also, like, put anybody who they referred to you, put that in their CRM notes, because people always want to know, like, well, how did you go? Like, I sent these people to you. I love to hear how that went. So, like, on those cards, like, say I met with, Gertrude, really enjoyed getting to meet her. Thank you for making that connection.
Uh-huh.
But, like, also put in the CRM, bring it up again. Because when you tell them thank you and they feel that reward, even if there's no money, nothing included, they're going to continue to do it. My thing is, if they send you, like, 3 referrals, get them a gift. That would be, like, my 3 to 5 referrals. If 3 to 5 people have said, Gertrude's told me your information, that is worthy of a gift.
It's also a good way to, like, specifically call your clients that are referring people. Check in, tell them how grateful you are for referring them, and it's another just, like, touch to that client.
Yes, I agree. It's another touch point. And when I say a gift, 2 things. Now, when it comes to a gift like that, you don't have to follow it within the $15 standard, because it's not tied to anything Medicare Advantage or Part D. It's just a thank you gift. You're also not paying for a referral, because that gets into a whole CMS situation as well. So you're not paying for a referral. You don't have to buy it. But it also doesn't have to be more than, like, a $10 gift, right? Like, as long as they feel like it's personal, maybe a gift card to a local restaurant or something like that. As long as they feel thought of and during that time, it doesn't have to break the bank to make it happen. You speak Olivianese. I appreciate that. I'm sure, like, whenever you and I are texting and you read my text messages, you're like, this girl's drunk and it's 9 a.m. No, I don't think so. I have the worst text. And, like, the thing is
worse
like,
than my sister-in-law.
That's, oh, no.
I can't think of any times you've really
literally it's
butchered words.
Everything. Like, quite literally, the people in the office is like, can someone speak Olivianese? I don't know what she's trying to say. It's awful.
I just read you.
I need more people to be like that. I just need more people to understand me. So thank you guys so much. Again, that is what we have for today, talking about, did you actually have a strong AEP? Did you actually grow? Do you know what worked? Do you know what didn't?
Do it now before the end of the year.
Do it now before the end of the year. And set your goals. It's insane how writing down your goals, there's so many Harvard studies and smart people that say this, but like, true testament, like, if you write down your goals, the amount that the likelihood of you hitting that goal is insane. So go crazy, write down a 5-year goal.
Unless you come 3 short.
You're not going to. I really think I'm going to manifest it. Obviously, you're getting 1 today at least.
Mm-hmm.
I really think you can get 2 before the end of the year without even trying. I think they're just going to come to
you. Well,
you have 12 days of AEP left. Not AEP. 12 days of the year. I hope so.
But the hard thing is their like business closed on Friday. So like their end of the year already happened. So as far as numbers, I know, but as far as like what's on the final numbers for our company, it shows 97.
I'm making this
even if I get 3 more.
Oh, even if you get 3 more, the reporting is just
will go on next year.
That's stupid. I would fight that. I will.
I know. So like, even though I know it was this year, it still really isn't. Like this one today will be January.
The 1st. Top 8 would you know yet? The top agent who got the most new agents from the agency.
New clients?
Yeah, new clients. Who is that?
Jeremy.
I don't know Jeremy
Mueller.
I don't know.
He's in Colorado, and I think he had like over 200.
How long has he been in the business?
He's pretty new.
I'd say so.
I'm pretty certain he had over 200.
That's nuts.
Yeah.
All right.
I know.
Well, on that note, guys, if there's any more questions, comments, concerns, threats, or promises, please let us know. It is likely that we will not have a cafe next Tuesday. I'm still deciding or not. The office is going to be pretty bare. I won't be in office. So we won't be available. It is likely that we will not have a cafe next Tuesday. Give you guys a week off. We've done 50.
Just ring in the year really good.
Yeah, we've done 51 of them. So surely we can take a week off this year. So
it's a Christmas miracle.
So we'll let you know. We'll send out notification if we are going to have one or not. But I just want to take the opportunity again to say thank you to our followers. Thank you to our listeners.
Yes,
we get to do this because you guys keep supporting us. So thank you. I don't even know. I am so appreciative of those who follow along with us
and participate and leave comments
and
give ideas.
I am thankful for Brian.
It makes it helpful for us too.
Brian and always Terry. Terry, you're my favorite.
Does anyone know if Medicare covers scleral contact lens?
So,
are those after a detached retina?
Yeah, or a cornea? Yeah. You may call our office and double check that. The best way to always double check is to go to Medicare.gov.
If it's medical, it would have to be.
If it's medically necessary, that's why they cover eyeglasses after cornea surgeries, because it's medically necessary. So like they'll cover things like that if medically necessary. One of the best ways to double check that is going to Medicare.gov, or of course you can call our office. We can look into that for you. I had a question
about someone seeing a dentist for TMJ.
What's TMJ?
It's a jaw issue. You haven't heard of TMJ?
Never heard of TMJ.
Oh my gosh.
Sounds like a drug.
We're living under a rock.
It's a rock without... We just live under we just are from very different rocks. All right, guys. Until maybe next year. You all have fun.
Make money.
And give impeccable service. Thanks.